As you're probably aware, the problem of skin cancer is on the increase. It's really important to remember the tips for looking out for signs of changes in the skin and signs of possible skin cancer. For a bit of background information, there are three main types of skin cancer in existence. These can be called squamous cell carcinoma, basal cell carcinoma and malignant melanoma. I'm sure most are familiar with malignant melanoma. However, that is not as common as basal cell carcinoma and squamous cell carcinoma. However, malignant melanoma is very serious and important to detect. The differences are primarily the colour and pigment in these cancers. The key point with malignant melanoma is it tends to be recognised by being a darker lesion, a darker brown lesion, whereas with squamous cell carcinoma and basal cell carcinoma, they may be more red in colour or more crusting. Basal cell carcinoma particularly can be more of a raised, colourless swelling. So the things to look out for all three types of skin cancer are best remembered by following the following rules. We use the ABCDE summary to highlight these rules. A standing for asymmetry, so if you notice a difference between either side of the lesion, so one side being a different shape to the other rather than a perfect or approximate perfect circle, then it's important to make a note of that and possibly seek help. If there's a change in the border, so the border is more jagged, irregular rather than a nice smooth edge, again pay attention to that. If there's a colour change, C for colour change, a mixture of colour, irregularities in the colour rather than a smooth uniform colour, it's important to make a note. Diameter, most skin lesions of concern are over 6 millimetres in diameter. So if there is growth in such a lesion, then pay attention. And E for edge, so a raised, rolled, inverted edge is another hallmark of concerning features. With all of these pointers, it's easier possibly to summarise in the following rules. If there's an increase in size, if there's a change in colour or a change in surface, then to pay attention, and if there's any sign of tenderness or discomfort or inflammation, then again to seek help. Pay attention to any bleeding, itching or oozing as well.